All right, so I'm recording. Chapter 7 is all about this, just called the skeleton in the book. And basically, it goes through all 206 bones in the human body, not some more than others. So that's where I'm going to start. There's two major divisions to the skeleton. So let me share the screen. And I'm going to talk a lot and probably not get a chance to write as much as I'd like to, because we would be here for about 3 hours if I wrote everything out. So I am going to speak and write down salient points, terminology that I think you need to know. I'm just going to write 206 bones. That's total in the human body. There's two major subdivisions of the skeleton. That's called the axial skeleton and the appendicular. The first half of chapter 7 is about the axial subdivision. The second half is about the appendicular. This one, axial, the first half of chapter 7, just think of basically if you drew a line down the middle of a person, down the midline of an individual, that line would touch the skull, the vertebral column, and what's called the thoracic cage. You would probably call that the rib cage. More scientific term is the thoracic cage. That should say vertebral column. That vertebral column, that includes the sacrum and the coccyx. So that's the axial part, the skull all the way down. The slang for the vertebral column is spine. So the skull all the way down the spine to the tailbone and the rib cage, the thoracic cage. The appendicular skeleton is basically everything else. Think of the word appendage. So our appendages, our arms and our legs, all the way out to our fingers and toes. That's the appendicular. I'll talk about that probably next week. I'm going to try to split this up into chapter 7 into 2 weeks, because there's a lot of bones in there, and there's a lot of terminology, markings, and information that needs to be learned. Okay, so let's just start with the axial skeleton. And that's what the rest of today's and probably next mini lecture is going to cover. The skull, this is just a breakdown, contains 22 bones. The hyoid, which is a bone, a disarticulated bone in the neck, is just one bone. Disarticulated means it's not connected to any other bone. It doesn't articulate with another bone. The vertebral column, including the sacrum and the coccyx, has a total of 26 bones. There's 24 vertebrae, and then there's the sacrum and the coccyx. Now, in the skull, there are facial bones and there are cranial bones. The facial bones break down to 14. The cranial bones break down to just 8. Well, that's where we're going to start today, is talking about mostly cranial bones and facial bones, talking about the skull in general. So I also want you to go back when you get a chance. I'll write this down now. Go back into this is all about chapter 7, but I do want you to use chapter 6, table 6.1 if you need it, because that is a table or a list of bone markings. Now we're going to use that table in detail. So now I'm not going to expect you to necessarily just memorize that table, everything that's in that table. But the more you use that table, the easier chapter 7 will be, because bone markings are just things on bones, like projections, crests, depressions, cavities, holes, all of those things have names. And that table defines what those names mean. For example, a process is something that sticks out from a bone. A foramen is a hole that goes through a bone. So that's what a marking is. Those are examples of markings. So let's start with the skull. I'm going to call up a new page. And we know that there are 22 bones total in the skull, 14 facial bones, 8 cranial bones. Now I'm going to define those on the next page. So when we say the skull has 22 bones total, that is excluding the auditory ossicles. Those are the 3 little bones in each hearing mechanism in each ear. So that's a total of 6 bones. There are the smallest bones in the human body are located inside of the middle ear in our skull on each side. So there's 6 total. There's 3 on each side, 3 right, 3 left. So when we say there's 22 bones in the skull, that does not include those 6 ossicles, okay? I just wanted to make that clear. So I'm going to start with the 8 cranial bones. Sorry about the writing there. I'm going to list those really quickly and then discuss them. So there is a frontal bone. There are 2 parietal bones. When there's 2 bones, it means they're in pairs, usually right and left. So there's 2 parietals, 2 temporals, an occipital bone, 1 occipital bone, a sphenoid, SPH. If you can't read my writing, it's SPHENOID. I have to prop up my right hand in order to do this correctly. And an ethmoid, ETHMOID. And that comes out to 8 cranial bones. So those are the 8 cranials. And by cranials, we mean mostly the top of the head. Facials, that makes sense. Those are all the bones that make up the face. So let's just list, I'll just list those so you have a list. 14 facial bones. Those are 2 nasal. Sometimes people just say the nasal bone, but really it's 2 bones fused together. 2 maxilla. Those are also fused. It's MAXILLAE, that's plural. That means more than 1. 2 zygomatic. Just so you know, those are our cheekbones. I'll discuss each of these in a little bit more detail in a moment. This is just a master list. 2 lacrimal bones. Those are on the inside of our orbit cavities, our eyes, where our tear ducts drain into. 2 palatine. That's the roof of the mouth, the hard palate. 2 inferior nasal concha, CONCHAE, that's plural, that means more than 1. And 1 vomer. Okay, so that's the master list. Now I'm going to try to talk about these bones as much as possible, one by one. Just a word, a hint for you. I'm not telling you don't read your book. Please read this chapter slowly and carefully. But because there's so much nitty-gritty detail, I'm going to tell you right now, since you're attending this lecture, that I'm going to use these lectures, these mini lectures, to grab the majority of my quiz questions from. So read the book and then watch these lectures. You're attending it right now, which is a great start. Try to rewatch it at some point because that's where most of the information will be pulled for the quizzes, okay? All right, let's get on with it. So I'm going to start up here, the frontal bone. This is where I can't write every single thing out, or else we wouldn't have time to get through the skeleton. So the frontal bone creates the forehead, basically. Just think of your forehead. That's where we can touch it and see it and feel it. That's a cranial plate. It also makes up what we call the superior roof of the orbits. That just means the eye cavities. So the roof of the eye cavities is also created by the frontal bone and the cranial floor. So if you could chop the head, if you could saw the skull in half lengthwise in a sagittal cut and just look at it dissected, you will see from the side, here's a skull. The frontal bone is this from about just past our hairline, and it comes down like this. That's what it looks like from the outside, but on the inside, it creates the floor of our eye cavities, which would be here, sorry, the roof of our eye cavities, which is here, and the floor of our brain cavity. Okay, so that's what we meant by it. That's what I meant by those descriptions. Technically, we're born with two of those, a right and a left, okay? But those fuse together soon after birth to become one bone. That's why we consider it one bone. that suture that is not visible where they fused after about age 7 or 8 years old. The frontal squama, this is just part of the frontal bone. This word squama just refers to the part of this frontal bone that forms the forehead. So the squama just refers to this part right here, sort of the ridge of the eyebrows and the forehead up front. The supraorbital margin is actually the thickening, the brow part right here. So the squama and supraorbital, supra means above, orbital means eye socket. Supraorbital margin is just basically think the thickening where our eyebrows are of that forehead part. There's also a foramen in there called the supraorbital foramen. Foramen just means hole, and there's a hole that goes through the bone where there's a nerve and artery going through that bone. So there's the frontal bone. I'll color it in yellow from the side. Let me finish my skull here. Here's the mandible. If this is the mandible, here are the teeth. Frontal bone is here. All right, let's move on to the parietal bones. In this case, sorry, that's an E, parietal. The parietal bones, there's two, and there really are two right and left bones. They do suture together on the top of the head. That's most of the roof of the cranium. So the front of the roof of the cranium is made by the frontal bone, but all of this is parietal on each side. It meets right on the top of it. The two parietals, the left and right parietals, meet on right at the sagittal margin on the top of the head. So parietals are in green, frontals in yellow. So we call this most of the roof of the cranium, and the sides, the lateral sides, are made up by the parietals. There are depressions, there are protrusions to accommodate blood vessels, all that business. I'm not going to require you to know every little depression and margin of the parietal bones because there's a lot of them. They supply those depressions, and the blood vessels and nerves supply the dura mater, which is the covering of the brain. Next, I'm going to identify the temporals. Most of us have heard of our temples on the sides of our head. So the temporal bones, there's two of those, right and left. I'll color those in blue. Now, there's many more markings on the temporals that I want you to know. So first of all, it makes up this lower side of the head here. It's called the inferior lateral portion of the cranium, okay? That's where the temporals are, both right and left side. And to tell you the truth, my parietal bone should have gone a little bit further back, like this. So that's roughly where the temporals are located. It's what we call the inferior lateral sides of the head. There's a right and a left. It makes up the temple region. Now, here's some markings that I do want you to know. There is a zygomatic process. Zygomatic process. Process means something that juts out or sticks out from a bone. The temporal process of the zygomatic bone. So if I expand this picture of my parietal bone here, of my temporal bone, there is a piece of bone that sticks out from it like this, that meets with, I'm going to have to draw it in black up here, that meets with a process from the cheekbone up here to form this ring, this arch of bone that sticks out from our skull, okay? The part that sticks out from the temporal bone, which I've drawn in blue right here, that's the zygomatic process of the temporal bone. This is confusing, I get it. It's just language though, just listen slowly. So the zygomatic process of the temporal bone sticks out, and it's going to meet the temporal process of the zygomatic bone of the cheekbone to make the zygomatic arch. All right, so that's something I want you to know. There is a mandibular fossa in the temporal bone as well. Let me write that down. Mandible means lower jaw. There's a mandibular fossa. Fossa means depression, like a crater. There's a mandibular fossa that articulates with the mandible. So when we open and close our mouths, what we are doing is moving our lower jaw. Sorry, I misspelled that. We're just moving our lower jaw, which is the mandible. And how we do that is there is a place of attachment of that mandible on the temporal bone right here. That's the mandibular fossa. That little groove is where the mandible inserts, and it articulates. This forms the temporomandibular joint. You've probably heard of TMJ. That's what that means, temporomandibular joint. So I need to clear up some space here. I'm still talking about the temporal bone. So this is just the temporal bone continued. There's a mastoid process. I'm trying to write down the key markings on each bone that I want you to pay attention to when you're reading or rewatching this lecture. Process is something that sticks out from a bone, unlike a fossa. So also on that temporal bone, so if I just draw a quick temporal bone here, which is just that plate that sits on the side of the head, here's that zygomatic arch that sticks out. There's the that mandibular fossa for the mandible to articulate. There's also a process that hangs down that looks like this, right here. I'll color it in red. Just so process is something that sticks out. The mastoid process is a place for muscles to attach and articulate. They're mandibular muscles. There are also air cells in here contains air cells to help with vibration in the middle ear. It helps with our hearing mechanism to be able to resonate sound in our skulls. It's almost like a mini sinus, but it's not considered a sinus. There are air cells in there that help with resonance of sound. It can become infected, those little air cells. That's called mastoiditis. The external auditory meatus is also a marking in the temporal bone. Meatus means a cavity. It's like a hole, but it doesn't penetrate all the way, it just doesn't go all the way through the bone. External means outside, auditory means hearing, meatus means hole or canal. That's what you and I would call the ear hole. That's where sound waves enter the skull. That's found in the temporal bone as well. There's an internal auditory meatus. I'm not going to write that down because it accommodates facial nerve. I think it's facial nerve number 7 and the vestibulocochlear nerve, which is cranial nerve number 8. But I do want you to know this one, the styloid process. That is another process like the red one, the mastoid process, only it looks different. It's long and slender and sharp, like this. I'll color it in so you can tell the difference between the two. It's this long, sharp, needle-like projection hanging down from the temporal bone, and it's attachment for muscles for the neck and tongue. So I'm just going to write attachment for tongue and neck muscles. Almost done with the temporal bone, and it's one of the worst ones, so just bear with me. There's 2 foramen that I'm going to jot down that are in the temporal bone as well. They're located actually on the underside of this bone, so you can't really see them from the external. If you turned a skull and looked at the underside of it, the inferior side, you'd be able to see these foramen, these holes. And the first one is called the carotid foramen. Some books say carotid canal, carotid foramen, and jugular foramen. I want you to know that they're located in the temporal bone. This is what foramen just means hole. So they're both just holes. There's one right, and there's 2 carotids, left and right. There's 2 jugulars, left and right. These are for just the carotid arteries to pass through from the aorta to supply blood to the head. And these are for the jugular veins to pass through. That takes deoxygenated blood back from the head toward the heart. So this supplies oxygenated blood to the head. This drains deoxygenated blood from the head, goes back to the heart. All right, that finishes up with the temporal bone. Now I'm going to go on to occipital bone. The occipital bone is the back of the head, I should say, and the underside. That's where it's located. So if I go back to my original diagram, this one here, the occipital bone, I've used up all my, I didn't use red on this one. This is the occipital bone back here. Colored it in red just to give you a pictorial view of what we're talking about. All right, so now let's go back to my description of it. So we just say it's the posterior and base of the cranium. That's what that means. Some markings that are very important in this bone is the foramen or foramen magnum. Foramen or foramen means hole, magnum means big. So it's a really large hole for the exit of central nervous system tissue, the spinal cord, from the brain. So the underside of that occipital bone here has, right on the underside, there's a big hole back here, and that's for central nervous system tissue to penetrate then down through the vertebrae. There is also something called the external occipital protuberance. It's hard to say quickly. This is just fancy language. The concepts are not difficult at all. The external means on the outside or the surface. Occipital means occipital bone. So it's a marking on the external surface of this bone, protuberance. This attaches to the C7. It helps attach our vertebrae, ligaments from our vertebrae in our neck, our cervical vertebrae, to the occipital bone here. It's just a crest. It's called a protuberance that helps support the neck ligaments and muscles themselves. All right, now we're almost finished with the cranial bones. There are two left, the sphenoid and the ethmoid. So those are located, you can't see them from the outside of the skull. You can see them just in weird angles. They're more on the interior of the skull. So sphenoid bone is sort of butterfly shaped or bat wing shaped. So I'm just going to write bat shaped. When you look at the diagram in your book, it's the one that looks like sort of butterfly shaped or bat shaped. If you look at it from a superior or inferior angle, it kind of looks like that. This bone is known as the keystone of the skull. The reason it's called that is it articulates with all other bones in the cranium. So I'm going to write that out. Articulates with all other cranial bones. So if all of these bones, I can't draw a three-dimensional picture, unfortunately, but if all of these bones, these cranial bones that I've been drawing here, 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 in the middle of the skull, right in here, they all somehow articulate with this sphenoid bone. You can't really see it from the side of the head. You can just see a little tiny piece of it. If you looked at it from the top, it would look something like this. That's why it's called bat-shaped or butterfly wing-shaped bone. It looks something like that. All right, let's get back to business. So it's known as the keystone. It contains a sinus. We have many sinuses, but this one is called the sphenoid sinus. If I have time, I'll talk about sinuses and their function. I'm just going to list the markings I want you to know. There is a groove on the superior surface of the sphenoid called the sella turcica. It's just a fancy name. It just means there's a formation there. And it's sort of from the top, it looks like this. There's a bump or a ridge that sticks up towards you, and then there's a depression in here, and then another ridge that sticks up. You could stick your little finger down in this groove right here. That's called the hypophyseal. I want you to recognize these words. That's all. You don't have to be able to spell them, but the hypophyseal fossa. Fossa means groove. This hypophyseal means hypothalamus / pituitary gland. It means below the hypothalamus. So this is where the pituitary gland sits in the brain, and it's protected by bone in this part of the sphenoid. So the hypophyseal fossa of the sella turcica is just where the pituitary gland resides. It sits down in this little groove of bone, and it's protected because the pituitary, when we get to the nervous system, you'll see the pituitary just hangs from the brain proper on this little stalk of tissue. So it's very fragile, and it sits down in this cavity, this fossa of bone, where it stays protected. In the sphenoid, there's also something called the optic foramen and canal. Optic means eye or eyesight. So this is where the optic nerve and artery run through. Foramen means hole. There's also something called the foramen or foramen ovale. That gets its name from its shape because it's oval shaped. The hole is oval shaped. And the foramen lacerum, foramen lacerum. I say foramen because that's how the person, my lecturer, when I was in your seat, my lecturer said foramen. Other people say foramen. These are just two holes. They're in pairs. There's one of these right and left. There's one of these right and left as well. These are just holes through the bone, and therefore the pharyngeal artery. So this bone is full of holes for arteries and nerves to pass through. There's a foramen rotundum. This is for a trigeminal nerve. I'm just going to write nerve. This is for an artery. I'm going to try to keep it as simple as I possibly can. Then there are superior orbital fissures, vessels, and cranial nerves. So I'm going to leave that one go. So I'm just pausing to make sure that I said everything I want to about the sphenoid bone. The ethmoid is the last of the cranial bones. This one is even harder to find visually in the skull because it is super deep in the skull. We can't see it at all from the surface. It's behind. I don't even have a color to show you. Let me try to draw a new picture for you. Let me go back here. So if I draw you a frontal view of the skull really quickly, then I'll be able to identify all of these cranial and facial bones. If I do this once, then I can just use this for the rest of the lecture. That's the maxilla, where the teeth are. Here's the mandible. This is a frontal view. There's the lower teeth sticking up. All right, there's our skull. And we've already identified the frontal bone, which basically the boundaries of that are here. The parietals you would just start to see on the edge here and here. This is the frontal bone. This is parietal. Temporals you would barely see from here at all. They would be, if I move the parietals, that's parietal. Temporal would be here. Yada, yada, yada. The ethmoid, which is what we're concerned about right now, is deep in the center of the skull. You can just barely see portions of it if you look in the nasal cavity here. Okay, so we can just see it basically is this funky looking thing. It looks honeycomb shaped. If I remove that bone, I'll try to do that and draw it singularly. It kind of looks like this. It has all these bone flaps and ridges. So there's what the ethmoid kind of looks like, and that's almost life-size by the, well, on my screen it's life-size. Obviously for a phone or something it isn't. So it's this gnarly looking piece of just jagged bone that's located right in the center of the skull, right here. All right, that gives you an idea of what it looks like and where it is. It's sort of between the sphenoid and our nasal bones, okay? This bone contains something called the cribriform plate. The cribriform plate houses olfactory foramina. That means little holes for our sense of smell. Olfactory nerves pass through there, and those nerve endings are sensitive to changes in the chemical atmosphere. They're sensory nerve receptors. It also contains something called the crista galli. This is an attachment up here. That's the crista galli, this pointy thing up at the top. That's an attachment for what's called the false cerebri of the dura mater. So it's just an attachment for dura mater is the thick fibrous outer covering around the brain tissue. It also contains air spaces for attachment of for ethmoid sinuses. I'm just going to write ethmoid sinuses. Sinuses are mucus-lined air cavities in our skull that have functions. Like I said, if I have time, I'll talk about those in greater detail. And lastly, about the ethmoid, I do want you to know this. This bone contains the superior and middle nasal concha. That's plural. If I left the E off, it would be singular. The nasal concha are they're bone-supported folds of tissue in our nasal cavity that if you were to look at them from the side, they would look something like this. They sort of look like Roman blinds. They drape, that's the superior and middle nasal concha. There's one below that called the inferior, but it's not included in the ethmoid bone. So I'm going to draw it separately. So those are the nasal concha. They're folds of tissue that swirl, moisten, and warm incoming air when we inhale air through our nose. All right, so I do want you to know that. It also increases surface area for our sense of smell. Okay, that takes care of the cranial bones. We're doing okay on time, so I'm going to be able to get through some of the facial bones. So now, facial bones are going to be in this region here. Basically, everything that I'm encircling in red from the front. Just think of face, you know that. I think that we're going to include the mandible, of course, at the end. So these are going to be facial bones. And we just finished all of this business. These were the cranial bones. All right, so let's move on with that. I'm going to start, just so you know, while I'm at my picture, I'm going to start right here at the bridge of the nose. Those are the two nasal bones that are fused together, okay? So now we're on to facial. I just want you to know that there's two fused together. They make up the bridge of the nose. where your eyeglasses would sit, or your sunglasses if you were wearing glasses. Now there are lacrimal bones just inferior. There's one left and one right. So lacrimal bones. I'll go back to my picture and show you where those are located. The lacrimals are, I'm going to use yellow, are located just on the inside of our eye sockets, the orbits, the orbital cavities right here and here, okay? Let me go back to my original board. All right, lacrimal bones. These are the smallest of all facial bones. They also, I want you to know this, that's where the lacrimal sacs or our tear ducts are located. There's a duct going right through the middle of this bone. It looks like a hole called the lacrimal sac. And that's where fluid from our eyes drains down into this hole through this bone. And what it does is it passes that fluid into our nasal cavity. All right, let's do the palatine bone. This is also two bones fused together. That's why I'm writing the word bones, right and left, but they're fused. So they appear as one bone. The palatine bone is the posterior, that means toward the back, hard palate. So if you run your tongue on the roof of your mouth, up toward your teeth is the anterior hard palate. If you move your tongue way to the back of the roof of your mouth, you can feel where it just starts to be soft tissue. Now your tongue, that hard tissue right before it becomes soft tissue, that's where the palatine bone is located. So it's the posterior hard palate, the back of the roof of your mouth. The inferior nasal concha, that was the one that was not included in my first picture. So just remind you what we're talking about there. When I talked about the ethmoid bone, it only houses the superior and middle nasal conchae. This third one down here is the inferior nasal concha. It's a separate bone. So that's what this is, the inferior nasal concha. Just know that it's a separate bone from they're separate from the ethmoids. Okay, the vomer, also very difficult to see and find. It's a single bone. This is a thin, small, triangular shaped bone. It's almost diamond shaped from certain views. It's the inferior portion of the nasal septum. So if I go back to a frontal view of the skull, don't know if there's any room here. It would, the vomer, you could see part of the vomer in the nasal cavity. Let me erase some of this. It would stick up like this. The vomer, you just see this little bit of it here. You can also see it from other views on a skull. If I were to take this skull and look at and tip it upside down and look at it from the underside, you'd be able to see that inferior surface of this bone. If I have time, I'll try to draw that for you when I do the maxilla, which is coming up next. The maxilla, before I leave this picture, that's going to be the next bone that I cover, is going to be this whole upper jaw region. Okay. And originally it's two bones that fuse together to form that plate, that upper jaw. So let's go back and do maxilla. We say maxillae with an E, that's plural because technically it's two bones that have fused together. This creates the upper jaw. It articulates with every other facial bone. So it's kind of like the keystone of the facial bones. Just like the sphenoid was the keystone of the cranial bones. Every other facial bone. That's the key. I'm going to put except the mandible. It touches the mandible at the teeth, the lower jaw, but it doesn't technically articulate with it, bone to bone. Right. The maxillary sinus, so it contains a sinus. Remember, a sinus is just a mucus-lined air cavity. The sphenoid had a sinus, the ethmoid had a sinus, the maxilla has sinus. So there's a sinus technically on both sides of the maxilla. So I'm just going to write maxillary sinuses. This thing, or these bones of the maxilla, they're pretty much completely fused at birth. If not, if they don't fuse properly just prior to birth, that's known as a cleft palate. And that maxilla, what a cleft palate is when that maxilla in the newborn is not fused properly. Finally, here, I'll just write that so you remember. Cleft palate syndrome is when these two bones don't fuse properly at birth. And finally, the last marking on this I want you to know is the infraorbital. I'll define this for you, don't worry. Infraorbital foramen. Foramen means hole. Infra means below. Orbital means eye socket. So we're looking for a hole that's right below the eye socket. Before I go back to my picture and show you where it is, I just want you to know it's where vessels and nerves are passed through. So I'm just going to write vessels and nerves. And where they're located, if you were to look at a skull, you would see two pinholes. They're a little bit bigger than pinholes, but not much. Right here and here. Those are the infraorbital foramen. I'm going to write down, I'm just going to list zygomatic bone. Those are the cheekbones. Let's do that in green. The zygomatic bones kind of look like this. Here and here. They make up this ring. All right. I'm out of space here, so I'm going to write zygomatic. I'm just going to write cheekbones. Remember, the zygomatic cheekbones, they have a temporal process that articulates with the zygomatic process of the temporal bone to create the zygomatic arch. If you look in your book, there's great diagrams. The zygomatic arch is that ring, that bridge of bone that juts outward. You can feel it on your own face, but it creates this hollow space. So it's this bridge of bone that comes out like this and creates this cavity or space in here. And that's for muscles to pass through, facial muscles, to help articulate the mandible, the lower jaw, to help move it. All right, let's go on to the mandible, which is the lower jaw. Sorry, I didn't mean to do that. Let me go back to this. Almost finished with the skull. So that's what it is. You know where it's located. This is considered the largest and strongest of all facial bones. It's the only movable bone of the skull. It contains a few markings that I'm going to list. First are that's mental, mental foramen. Foramen or foramen means hole through the bone. We learned this way back in chapter 1 at the beginning of the semester. It's a region, a surface region on the face, and it's right where the chin is. And there's two of them, one on either side. And those mental foramen is for what's called the mental nerve. And that nerve is commonly anesthetized by dentists. I'm just going to write this down. For the mental nerve, dentists anesthetize this nerve. They do work in your mouth. Now I'll show you the location of those mental foramen. If you were to look at the mandible, there's little, just like those infraorbital foramen up here, there's two little holes right here on our chin that nerves pass through, that mental nerve. Almost done. What you and I call the nasal septum is really a combination of things. That nasal septum is really the vomer bone, that little tiny diamond-shaped bone on the floor of the nasal cavity. It's also made up of the septal cartilage. So it's what you and I call the nasal septum is a combination of bone and cartilage, and the perpendicular plate of the ethmoid coming down from the top of the nasal cavity. Okay. That's what makes up our nasal septum. This is usually what gets damaged when we say somebody broke their nose. So I'm just going to put this in quotes. A broken nose is typically some sort of damage to this area, this nasal septum area. Almost always, it's damage to this cartilage. It's rare that this bone or this bone gets broken. It's not impossible, but a broken nose is usually a separation or damage to the septal cartilage, which makes up part of that nasal septum. Before we leave, last thing I promised that I'm going to talk about right now are the sutures of the cranial plates. So let me call up a blank page. I had one left right here. A suture literally just means an immovable joint. So it's where two bones literally looks like they fuse together. Sometimes they fuse so early, either before birth or just after birth or when we are so young, that we really can't see that joint anymore. They really fuse almost to one complete bone, or literally to one complete bone. But in bones that fuse later than just after birth, for example, in the cranial plates, those are the sutures that I'm going to list, just the major sutures of the cranial plates. Those are the ones I want you to know. And there's literally just 4 of them. I'll list them for you. They look like this. If a bone, say that the parietal bone on the top of the head on the right side comes to meet the parietal bone on the top of the head on the left side, they literally form this interlocking joint. It looks like a jigsaw puzzle like this. And they fuse, and you see this squiggle line like this. That's bone on bone fusion together. There's a tiny bit of fibrocartilage, fibrous tissue that knitted those together, but it's a totally immovable joint. Now let's list them. There's a sagittal suture. The sagittal suture literally runs between the one I've drawn in my picture, right and left parietal bones. Okay, so looking at the top of the head, it runs right down the center of the head. There's also a frontal suture, sometimes also called, I'm going to write its other name, the coronal suture. That one, if this is the forehead now, here's an eye socket coming down forehead. Here's the other orbit or eye socket. This would be the nasal cavity. So this is the frontal bone. There's a suture between the frontal and the parietals. That's the frontal suture. And the left and right parietals. Now looking at the posterior side of the head, I'm going to try to draw a better picture for you. So I'm going to use a diagram in your book as reference. Let's do the side of, I'm going to draw a picture of the side of the skull so you can see these sutures better. Here's just the beginning of the eyes, nasal cavity. This is the occipital bone coming down underneath. There's the mastoid process. So this would be the frontal suture here. We wouldn't see the sagittal suture. It would be up here on top of the head, right here between these 2 bones, these 2 parietals. There's the frontal. Now, there's a squamous suture that runs from between the parietal and the temporal, like this. There's one right and one left. So I'm going to write squamous sutures, right and left, and they're between the parietals. Right, so let me spell that correctly, so you spell it correctly. Between the parietals and temporals. And finally, there's the lambdoid suture, L-A-M-B-D-O-I-D. This one's on the back of the head, and it runs between the occipital bone here and the parietals. It actually extends. There's another suture that comes down here. We're not gonna pay attention to that one. So this would be the lambdoid suture here. This would be the squamous suture here. This is the frontal suture here, and sagittal suture, I'll write S-A-G up here. Lambdoid suture is between the back, the posterior side of the parietals and the occipital bone. If I have time at the next lecture, I'll talk about the fontanelles. And I'm also going to, I'm going to talk about the paranasal sinuses a little bit more because I want you to know functions of those. And I'll talk about the fontanelles, which are dense fibrous connective tissue in the unfused cranial plates of a newborn child. But I want to cut it off here because our hour is up. And so I'm going to cut my recording.